Ladies and gentlemen, welcome to the Drug Index. Health is wealth. Today we are going to look at an interesting drug which is called methcobal D. So about this, we'll be seeing how it works, how it can be used, the dosage form. So it will be an interesting part about this drug, which is very important. I'm saying this because I was prescribed this drug, so it helped me a lot. So I said, you as the lovers of the Drug Index, why shouldn't we tackle it? Don't leave without subscribing, liking and sharing this video, because I know it might help a lot of people. A short story before we start. I had issue with vitamin B12, so I went to the hospital. They did my blood checkup. So after doing my blood checkup, they gave me this drug. The doctor told me to be taking this drug, so it was a very important drug that helped me to recover from 4.5 hemoglobin level to raise it up to 13.5. So let's start with this, so because it's a very interesting part which I need everyone to follow attentively, and please keep liking and subscribing to the channel if you are new. Methcobal D. Methcobal D tablet is naturally occurring pure form of vitamin B12. It is taken to regulate certain vital bodily functions like cell multiplication, blood formation, and protein synthesis. It is used to treat vitamin B12 deficiency in people with pernicious anemia. Why do we need methcobal D tablet? I told you the reason why and even a short story of what happened. But how does it work? How does it produce its pharmacological effect? Methcobal D tablet helps to treat nephropathy and supposed to help the help of the brain, where alpha lipoic acid is antioxidant, delays or reverses diabetic neuropathy. Folic acid is useful for enhancing nerve conduction velocity in diabetic neuropathy. Methylobalamin works by producing a compound called myelin, which covers and protects nerve fibers and helps to rejuvenate the damaged nerves. Pyridoxine is an essential nutrient which is required for the metabolism of lipids, carbohydrates and proteins. It is also needed for the synthesis of neurotransmitters or chemical messengers, and vitamin D increases the level of nerve growth factor, helps in developing and survival of nerves by stimulating its production and preventing its depression. There are many uses of this tablet, except that one that I had said, for treating vitamin B12 deficiency. Other uses are like diabetic neuropathy, alcoholic neuropathy, diabetic retinopathy, peripheral neuropathy, Parkinson's disease, Alzheimer's disease, and chronic pain. So those conditions can be treated by using this methcobal D tablet. Dosage of this tablet, one tablet is given a day as a physician directs you, but mainly it is taken at noon after eating. There are some contraindications of this tablet, methcobal tablet. The contraindications include it should be used with caution in patients suffering from kidney impairment and kidney stones, heart problems, and consult your doctor before taking these tablets. Methcobal tablets should be used in caution in pregnant and breastfeeding women. Consult your doctor if you experience any side effects after taking this medicine. The adverse effects, they are not that many, but they are there because this drug sometimes is safe, but there are some adverse reactions that might occur when you are taking it. One is nausea, and another one is anorexia, and the last one is diarrhea. And about the storage conditions, you should keep it protecting it from light and moisture, and should be kept in a place that is below 25 degrees Celsius, and just keep it away from children. Stay with us. Ladies and gentlemen, welcome to the Drug Index. Health is wealth. Today we are going to talk and see more about hypertension. So we can start with the etiology of hypertension. A specific cause of hypertension established in only 10 to 15 patients. Patients in whom no specific hypertension are said to have essential or primary hypertension. Patients with a specific etiology are said to have secondary hypertension. Genetic factors, physiological factors, stress, and environmental and dietary factors as contributing to the development of hypertension. The heritability of essential hypertension is estimated to about 30%. After that, seeing the etiology, we can see classification of hypertension on the basis of blood pressure. So for the normal person, the blood pressure will be less than 120, and for the pre-hypertension it will be between 120 and 80, and for hypertension, as hypertension to be greater or equal to 140 per 90 milligram. There is stage 1, which will be between 140 and 90, and there will be stage 2, that will be between 160. It will be greater than 160 per. Regulations for blood pressure according to the hydraulic equation. Arterial blood pressure is directly proportionate to the product of the blood flow, which is the cardiac output, and the resistance to passage of blood through capillary arterioles, peripheral vascular resistance. So the blood pressure will be equal to the cardiac output, which is multiplied by the peripheral vascular resistance, which can be abbreviated as BP, will be equal to CO times PVR. And about that, blood pressure is maintained by the moment-to-moment regulation of cardiac output and the peripheral vascular resistance exerted at the three anatomic sites: arterioles, postcapillary venues, capacitance vessels, and the heart as well, the kidney, baroreflexes mediated by autonomic nerves, which is a combination of the humoral mechanism, including the renin, angiotensin, and aldosterone system. Local release of active substances will be bringing it together in the regulation of the hypertension. So there is antihypertensive agents, or you can call them antihypertensive drugs, which are drugs or agents that are used to treat hypertension. So we have a broad classification, but we will be looking at each and every one of it. So the first class will be diuretics, which will be containing thiazides, high saline, and potassium sparing. In thiazides, which is under diuretics, it is having drugs like hydrochlorothiazide, chlorothalidone, adapamide. So next to that, there's high saline, which also falls under diuretics, which will be having an example like furosemide, and the last subclass of diuretics will be potassium sparing, which will be having examples like spironolactone, amylolide. And the next class of antihypertensive agents will be ACE inhibitors, which will be having examples like captopril, enalapril, lisinopril, perindopril, amipril, and fosinopril. And another class of antihypertensive agents or antihypertensive drugs will be angiotensin blockers, which will be containing losartan, candesartan, irbesartan, valsartan, and many others. Under that, we'll be having the lectrin inhibitor, which will be containing ariciclin, which is the only drug which is available now under the class. We have beta adrenergic blockers, which will be containing like propanolol, metoprolol, atenolol, and many others. Another class that will be there will be calcium channel blockers, which will be containing verapamil, diltiazem, nifedipine, ferrodipine, amlodipine, and many others. And another one will be beta and alpha adrenergic receptors, and we'll be having examples like labetalol, carvedilol, and many others. And those ones which are specific for blocking the alpha adrenergic receptors are like terazosin, doxazosin, phentolamine, and many others. And we have those ones that act centrally, central sympatholytics, which will be containing clonidine and methyl-dopa. And the last one in this class will be vasodilators. Among vasodilators, we'll be having those ones that dilate the arteries, which will be containing hydralazine, minoxidil, diazoxide. And there are those ones which are not specific, which will be dilating both arteries, and which will be arteriolar and venous vasodilators. And the main common example in this class will be sodium nitroprusside. And there are other drugs that might be used to treat hypertension, like adrenergic neuronal blockers, which will be containing dizapine, guanidine, and others will be like ganglionic blockers, which will be containing like pentorrhenium. Next to that, we can start with talking about these drugs in detail. We start with thiazide, which is falling under a class of diuretics. Thiazide diuretics such as hydrochlorothiazide and chlorothalidone lower blood pressure initially by increasing sodium and water excretion. Thiazide diuretics can induce hypokalemia, hyperuricemia, and to a lesser extent hyperglycemia in some patients. Next to that, we can see about loop diuretics, which are these antihypertensive agents that will be also falling under diuretics, and they will be acting on the loop Henry of the nephron. Inhibitors of epithelial sodium transport at the red distal and collecting ducts, like furosemide and ethocyclinic acid receptor, and reduce potassium loss in the urine. Aldosterone antagonists have the additional benefit of diminishing the cardiac remodeling that occurs in heart failure. The third subclass of diuretics, which is potassium sparing, the loop diuretics like amylolide, torsemide, bumetanide act promptly by blocking sodium and chloride reabsorption in the kidneys, even in patients with poor renal function or those who have not responded to thiazide diuretics. Loop diuretics cause decreased renal vascular resistance and increase the renal blood flow. The next one, now we'll be having ACE inhibitors. The ACE inhibitors are recommended as first-line treatment for hypertension in patients with variety of comparing indicators, including high coronary disease risk, or history of diabetes, stroke, heart failure, myocardial infarction, or chronic kidney disease. ACE inhibitors is also responsible for the breakdown of bradykinin, a peptide that increases the production of nitric oxide and prostacyclin by the blood vessels. Both nitric oxide and prostacyclin are potent vasodilators. ACE inhibitors decrease angiotensin II and increase bradykinin levels. Vasodilation is also a result of decreased vasoconstriction from diminished levels of angiotensin II and enhanced vasodilation from increased bradykinin. By reducing the circulating angiotensin II levels, ACE inhibitors also decrease the secretion of aldosterone, resulting in a decreased sodium and water retention. ACE inhibitors reduce both cardiac preload and afterload, thereby decreasing the cardiac work. So that's how they actually work. And next to that, we can see the adverse effects of ACE inhibitors. The adverse effect profile of all ACE inhibitors is similar. Captopril is well tolerated by most patients, especially in the dose is kept below 150 mg. Hypotension, an initial sharp fall in blood pressure, occurs especially in diuretic treated and chronic heart failure patients. And others adverse effects you can say is like hyperkalemia, cough, rashes, urticaria, angioedema, and others are like dysgeusia, photopathia, headache, dizziness, nausea, and bowel upset, glomerulocytopenia, and proteinuria, which is rare. And the last one we can talk about the adverse effects of this ACE inhibitors is like acute renal failure. So after this, let's see the advantages. The advantages of ACE inhibitors. The first one we can say is free of postural hypotension, electrolyte disturbances, feeling of weakness, and CNS effects. The next one will be safety in asthmatics, diabetics, and peripheral vascular disease patients. So it will be safe in those patients. The next one is long-term ACE inhibitors. Therapy has the potential to reduce incidence of type 2 diabetes in high-risk subjects. Then the other one we can talk about is non-rebound hypotension on withdrawal. So in that way it can be used. And another one is about no hyperuricemia, no deleterious effect on plasma lipid profile. And another one, ACE inhibitors are the most effective drugs for preventing sudden cardiac death in post-infarction patients. However, they are less effective for primary prophylaxis of MIE and for preventing left ventricular hypertrophy. Some uses of ACE inhibitors, like they are used to treat hypertension. The ACE inhibitors are the first-line drugs in all grades of hypertension, but the angiotensin receptor blockers have now suppressed them in popularity. But essential hypertension respond to monotherapy with ACE inhibitors, and the majority of the rest to their combination with diuretics or beta blockers. Another use is they are used in congestive heart failure because ACE inhibitors cause both arterial and venodilation in CHF patients, reduced afterload as well as preload. Myocardial infarction is another use of these ACE inhibitors. Long-term ACE inhibitors therapy reduces recurrent MI. Another one is prophylaxis in high cardiovascular risk subjects. ACE inhibitors are protective in high cardiovascular risk subjects even when there is no associated hypertension or left ventricular dysfunction. ACE inhibitors may improve endothelial function. And another one is diabetic nephropathy. Prolonged ACE inhibitor therapy has been found to prevent or delay end-stage renal disease in type 1 as well as type 2 diabetics. And another one is non-diabetic nephropathy. ACE inhibitors reducing proteinuria by decreasing pressure gradient across glomerular capillaries as well as by altering membrane permeability. Scleroderma crisis, the marked rise in blood pressure and deterioration of renal function in scleroderma crisis is mediated by ACE inhibitors, which produce improvement and are life-saving in this condition. Angiotensin antagonists, which include losartan, candesartan, dasatartan, telmisartan, and many others. It's another class of antihypertensive agents or antihypertensive drugs. Their pharmacological effects of ARBs are similar to those of ACE inhibitors, but these angiotensin antagonists produce arterial and venous dilation and block aldosterone secretion, thus lowering blood pressure and decreasing salt and water retention. These angiotensin antagonists do not increase bradykinin levels, may be used as first-line agents for the treatment of hypertension, especially in patients with compelling indication of diabetes, heart failure, and chronic kidney disease. There is also the renin inhibitor, a selective renin inhibitor, which is recyclin, directly inhibits renin and thus acts earlier in the renin angiotensin aldosterone system than ACE inhibitors or angiotensin antagonists. It lowers blood pressure about effectively as angiotensin antagonists and ACE inhibitors, and also says that recyclin should not be routinely combined with an ACE inhibitor or angiotensin antagonist. Recyclin can cause diarrhea, especially at high doses, and can also cause cough, angioedema, but probably less often than ACE inhibitors. Recyclin is contraindicated during pregnancy, so that's a notice that should be taken. Beta adrenergic blockers, these ones are mild antihypertensives and do not significantly lower blood pressure in normotensives. In stage 1 cases of hypertensive patients, like 30 to 40% B adrenergic receptors are used alone. B propranolol is a fast B adrenergic receptor blocker showed effective in hypertension and ischemic heart failure. Propranolol has now been largely replaced by cardioselective beta blockers such as metoprolol and atenolol. All beta adrenoreceptor blocking agents are useful for lowering blood pressure in mild to moderate hypertension. In severe hypertension, beta blockers are especially useful in preventing the reflex tachycardia that often results from treatment with direct vasodilators. Metoprolol and atenolol, which are cardioselective, are the most widely beta blockers in the treatment of hypertension, but metoprolol and atenolol is inhibiting stimulation of beta-1 adrenoreceptors. Sustained release of metoprolol is effective in reducing mortality from heart failure and is particularly useful in patients with hypertension and heart failure. Atenolol is reported to be less effective than metoprolol in preventing the complication of hypertension. There are other beta blockers which are like nadolol and cateolol, non-selective beta receptor antagonists. Betaxolol and bisoprolol beta 1 selective blockers, pindorol, acetabuterol, and phenbuterol are partial agonists, which means beta blockers with some increasing sympathomimetic activity. These drugs are particularly beneficial for patients with blood arrhythmias and peripheral vascular disease. And after that, other beta blockers like labetalol, carvedilol, nebivolol have both beta blocking and vasodilating effects. Esmolol is a beta 1 selective blocker that is rapidly metabolized via hydrolysis by red blood cell esterases. Esmolol is used for the management of intraoperative and postoperative hypertension, and sometimes for hypertension emergencies, particularly when hypertension is associated with tachycardia or when there is concern about toxicity such as aggravation of severe heart failure. Other ones like alpha-adrenergic blockers are like prazosin, terazosin, doxazosin, where prazosin is a prototype alpha-1 adrenergic blocking agent, and terazosin and doxazosin are long-acting congeners of prazosin, and alpha blockers reduce arterial pressure by dilating both resistance and capacitance vessels. Other alpha adrenergic receptor blocking agents are like phentolamine, which is a reversible and selective alpha adrenergic antagonist, and phenoxybenzamine, which is also a non-selective irreversible alpha blocker, which are useful in diagnosis and treatment of pheochromocytoma. Centrally acting adrenergic drugs like clonidine acts centrally as an alpha-2 agonist to produce inhibition of sympathetic vasomotor centers, decreasing sympathetic outflow of the periphery. This leads to reduced total peripheral resistance and decreased blood pressure. At present, it is occasionally used in combination with a diuretic. And another one is a methyl-dopa. It is an alpha-2 agonist that is converted to methylnorepinephrine centrally to diminish adrenergic outflow from the CNS. It is mainly used for management of hypertension in pregnancy, where it has a record of safety during pregnancy. Vasodilators like hydralazine, dehydralazine, which is another name of hydralazine, and minoxidil, not used as primary drugs to treat hypertension. These vasodilators act by producing relaxation of vascular smooth muscles, primarily in arteries and arterioles. This results in decreased peripheral resistance. Both agents reproduce reflex stimulation of the heart, resulting in the competing reflexes of increased myocardial contractility, heart rate, and oxygen consumption. Hydralazine is an accepted medication for controlling blood pressure in pregnancy induced in hypertension. This drug is topically to treat male pattern baldness. Treatment of hypertension. Hypertension emergence. It is rare but life-threatening condition. A variety of medications are used, including calcium channel blockers, nitric oxide vasodilators, adrenergic receptor antagonists, the vasodilators like hydralazine and dopamine, dopamine agonist N-dopam. And the treatment of hypertension, resistant hypertension, it is defined as blood pressure that remains elevated despite the administration of optimal 3-drug regimen that includes diuretic. The most common causes of resistant hypertension are poor compliance, excessive ethanol intake, concomitant conditions like diabetes, obesity, sleep apnea, hyperaldosteronism, high salt intake, metabolic syndrome. And another one is concomitant medications like sympathomimetics, non-steroidal anti-inflammatory drugs, antidepressant medications, and another ones like insufficient dose of drug, and many others. Thank you for being with us. Stay in touch. This was the Drug Index. What's up guys, welcome back to my channel. It has been a while, but I welcome you back to the Drug Index. I have a question in mind that I would like to ask you too, and I also asked my same question to myself too. Like, who knows, I'm talking to you watching this video, who knows what we mean by essential medicines? There was a definition that was given by the WHO, which is World Health Organization, and according to that, essential medicines are those that satisfy the priority healthcare needs of the population. They can save lives, reduce the suffering, and also improve the health. The World Health Organization, which is WHO, periodically updates its model list of essential medicines. The list includes medication considered for crucial for addressing the priority health needs of population, as I said in the definition. Please know that the information might be outdated, you might not know, so you need to check for the recent publications after these ones, because as I might be recording this video now, you might watch it later, so remember to check on the WHO list. Let's see the top 10, like the 10 mostly used medicines that is under the essential medicines listed by WHO, and you see the uses, what they are mostly used for, and stay in touch with us. If you have not yet subscribed to our YouTube channel. That's a great support to us, and don't forget to like this video. In addition to that, it will be more helpful if you share this video to your friends or your colleagues or anyone that might be interested, because these drugs are really, as I said, essential in life, so you should know them. The first one that we have is acetaminophen. Many people know it like that, but you can also call it paracetamol. This drug or this medicine, mainly in tablets or even injections, it is used as analgesic. Guys, who knows what analgesic means? Write it in the comment section. Analgesic means pain relief, like saving people from that pain or helping reducing that pain. And paracetamol is also used as an antipyretic, which refers to those drugs or medicines that reduce fever. The second one we have is aspirin or you can call it as acetylcyclic acid, and it is also used as an inflammatory as well as paracetamol is. It is used also as an anti-inflammatory and also used as an antiplatelet, or you can call it a blood thinner. The third one on our list is ibuprofen. This one is an NSAID, or call them non-steroidal anti-inflammatory drugs, which is used to relieve pain and also used as an anti-inflammatory drug. The fourth one on our list is amoxicillin. This one is an antibiotic. Mostly people use it for bacterial infections. Number 5 is morphine, which is used as an opioid analgesic for severe pain relief. Number 6 on our list is lisinopril. This one is used as angiotensin converting enzyme inhibitor, which is used to treat hypertension and heart failure. Number 7 is metformin, which is also used as an anti-diabetic medication for treatment of type 2 diabetes. I think you know the types of diabetes, right? I think you know. If you don't know, write it in the comment section. We'll come to this maybe in the next video, who knows. Number 8 is rifampicin, isoniazid, pyranillamide, and ethambutol, and a combination of these medicines is used for treating tuberculosis, TB. The number 9 is omeprazole. This one is a proton pump inhibitor, which is used for the treatment of gastroesophageal reflux diseases, which is abbreviated as GERD, and used also to treat peptic ulcer. Number 10 is salbutamol or albuterol, which is used as a bronchodilator to treat asthma and also chronic obstructive pulmonary diseases, COPD. Closing up on this, it's crucial to verify this information as I gave it to you, and I also told you when I was starting. Just check for an update depending on when you are watching this. Isaac, I'm signing out. The drug index. Welcome to the drug index. Health is wealth. So we are going to see tranexamic acid. Before we start about this drug, you know it is usual for females to have the menstrual cycle. So during that period, they might experience a heavy bleeding. So if they experience heavy bleeding or heavy periods, so they should take this drug called tranexamic acid. So let's see more about this. Tranexamic acid, sometimes shortened as TXA, is a medicine that controls bleeding. It helps your blood to clot and is used for nosebleeds and heavy periods. If you are having a tooth taken out, using tranexamic acid mouthwash can help to stop bleeding. Tranexamic acid can also help you if you have a condition that causes swelling under the skin, which might be hereditary angioedema. If you have any condition that causes you to bleed more than usual, you need to take tranexamic acid too for a few days before having a surgery or then surgery. Tranexamic acid comes as a prescription, as tablets are there of this drug, liquids are there for this drug, for children or people who are finding it difficult to swallow. Mouthwashes are there, and also injections are there, which are usually given in the hospital, not like giving it to someone to take it out. Tranexamic acid tablets for heavy periods are also available to buy from pharmacies for adults aged above 18 years, or from 18 and above, not only above 18, from 18 and above. There are some key facts about this drug. You will usually take tranexamic acid for a few days at a time. You can take the tablet with or without food, so it has no food interaction. Most people do not have any side effects when taking tranexamic acid, so it sounds safe. If you also take the combined contraceptive pill, there is an increased risk of deep vein thrombosis with tranexamic acid. Brand names of this drug include cyclocapron, Cyclo-F, and menstrualite. So if you go to the market, you tell them this tranexamic acid, they don't understand, you can give them these brand names, so they will be knowing how to help you, because it is a very important drug. And you might ask yourself who can take it or who cannot take it. The answer is tranexamic acid can be prescribed for adults and children of all ages. That is not limited to any age. Tranexamic acid is not suitable for some people, actually. To make sure tranexamic acid is safe for you, tell your doctor before this medicine if you have had an allergic reaction of tranexamic acid or any other medicine in the past. Have you ever had a deep vein thrombosis or pulmonary embolism, like which is blocked blood vessel in your lungs? Have had a coagulopathy, but this is a rare condition where lots of small blood clots form in your blood followed by abnormal bleeding. If you have ever had epilepsy, kidney problems, or pregnant or trying to get pregnant, have irregular periods. So those are the conditions before a doctor prescribes this drug for you. You should tell your doctor that I have these ones, and these ones, so that you might be safe. How and when to take this drug? You might ask yourself. If you are prescribed tranexamic acid tablets, you can take them with or without food, as I had said earlier. If you have told to take the tablets 3 or 4 times a day, try to space the doses evenly throughout the day. If your dentist has prescribed tranexamic mouthwash, this might come as a ready-made mouthwash or as a tablet that you mix with water. Follow the instruction that will be given to you by the dentist who gave you the drug. And another one about the dosage forms. Tranexamic acid comes with as 500 milligram tablets for adults. The usual dose is 2 or 3 tablets taken 3 times a day. Doses are usually lower for people with kidney problems, as we saw that they might experience other problems if they take a lot of it. The liquid comes in different strengths. Follow the instruction on the label to make sure you take the right dose. If your children is prescribed tranexamic acid, the doctor will use your child's weight or age to work out the right dose to be given to your child. Will my dose go up or down? Most people taking tranexamic acid take 2 tablets, which should be 1000 milligram a day, 3 times a day, or maybe it depends. If this is not working well enough to control bleeding, your doctor may tell you to take 2 tablets a day, like 2 tablets 4 times a day. What if I forget to take my dose? What happens, or what can I do? If you forget to take your dose of tranexamic acid, take it as soon as you remember, unless it's nearly time for your next dose. In this case, skip this missed dose and take the next one at the usual time. Do not take 2 doses at the same time. Never take an extra dose to make up a forgotten one. If you forget doses often, it might be good for you to set an alarm or talk to your doctor on how you can manage to remember the time. What if I take too much? Taking 1 extra dose of tranexamic acid by accident is unlikely harm to you. However, if you take too much, you may get side effects. This can include feeling or being sick, diarrhea, dizziness. Speak to your doctor if you are worried if these side effects are troubling you. The other side effects, like all medicines, tranexamic acid can cause side effects, although not to everyone. Common side effects include feeling sick, nausea, diarrhea, itch skin. The most serious one, side effects might happen in 1 out of the 1,000 people, but they include serious allergic reactions. In rare cases, it is possible to have serious allergic reactions, which are anaphylaxis to tranexamic acid. These are not all side effects of tranexamic acid. For a full list, see the leaflet inside your medicine pack, because if you are given, they show you everything about this drug. So if before you take it, you can read the leaflet that will be put in the packet of your medicine. How can I cope with my side effects if I'm taking this drug? Like, what can I do about it? Like feeling sick or having this nausea. If you feel sick after having the injection, it may help you if you avoid rich or spicy food, if it carries on all the effects or even severe, or tell your doctor. They may be able to prescribe an extra medicine to help you treat these symptoms. And if you are having diarrhea, if you get diarrhea after having the injection, drink plenty water to avoid dehydration. Signs of dehydration include being less than usual or having dark or strong smelling pee. Tell your doctor or pharmacist if it carries on. Sometimes reducing the dose helps. Itch, red skin. Apply a soothing cream such as a moisturizer, at inch cream, or a lotion. If the skin is dark red, get worse, or carries on for more than a few days, speak to your doctor directly. How about during pregnancy and breastfeeding? Tranexamic acid is not usually recommended if you are pregnant. This is an attention that you should take. This is because there is not enough information to say whether it's safe. So if there are not such kind of information, it's safe for you not to take it. However, your doctor may prescribe if they think the benefits of the medicine outweigh the risk. If you are pregnant or trying to get pregnant, talk to your doctor about benefits and possible risks of taking tranexamic acid. And tranexamic acid during breastfeeding. Small amounts of tranexamic acid may get into breast milk. However, medicine is generally considered as safe for breastfeeding mothers and babies. Talk to your doctor if you have any concerns about taking tranexamic acid during breastfeeding. There are some cautions with other medicines. Tranexamic acid can be taken with most other medicines. However, talk to your doctor or pharmacist if you are taking the combined pill. There could be a very small increased risk of getting a blood clot if you are if you take tranexamic acid as well. Mixing tranexamic acid with herbal remedies or supplements. There is no enough research to say whether a herbal remedy or supplement are safe to take with tranexamic acid. This is because they have not tested in the same way as prescription medicines. This is an important note. Tell your doctor or pharmacist if you are taking any other medicine, including herbal medicines or herbal remedies, vitamins or supplements, so that they can know how to deal with you to get okay. Drug index. Health is wealth. Like, comment, share, and subscribe for more. Stay in touch. Drug index. Health is wealth. Today we are going to see amoxicillin. It is our next drug on our channel. So if you are new to the channel, please subscribe, like, and comment. And let's go deep and see what amoxicillin looks like and how it works, why you need it, who should take it, like interesting things like those ones. Before we go deep, let's see something about amoxicillin. Amoxicillin is a penicillin antibiotic. It is used to treat bacterial infections such as chest infections, including pneumonia, dental abscesses. It can also be used together with other antibiotics and medicines to treat stomach ulcers. It's often prescribed for children to treat ear infections and chest infections. Amoxicillin is only available on prescription. It comes as capsules or as a liquid that you swallow. It's also given by injection, but this is usually done in hospitals only. Another question that you should ask yourself is, who can and who cannot take amoxicillin? Amoxicillin can be taken by most adults and children. That means many can take it. Find out more about giving amoxicillin to children on a website like Medicine for Children, websites like those ones. They are having information about the amoxicillin for children. Amoxicillin is not suitable for everyone. As I said before, a medicine or a drug or a tablet, it can't be suitable for everyone. To make sure amoxicillin is safe for you, just go to your doctor. If you're not feeling fine, just go to your doctor. Have you ever had like allergic reaction to amoxicillin or penicillin or any other medicine? So inform your doctor before he or she prescribes this drug to you. Have liver or kidney problems, so inform your doctor about this. Have recently had or due to have any vaccination. So these are the informations. Once you go to the doctor to avoid adverse effects of this drug, you should inform your doctor about this. How and when to take amoxicillin. The usual dose for amoxicillin capsules is 250 to 500 milligram, taken 3 times a day. The dose may be lower for children because they can't take the same dose as adults. Amoxicillin liquid is available from 125 to 250 milligram doses. Carry on taking this medicine until you completed the course, even if you feel like you are not feeling the same way you felt before, because the infection could come back, and when it comes back, it might be stronger than before. So better finish the prescription that you were given by your doctor. Try to space the doses evenly throughout the day. If you take it 3 times a day, this could be first this morning or midday and at bedtime. Like in the morning you take one, midday you take one, and even at night you take another one. So you give spaces between these drugs. You can take amoxicillin before or after food. It has no interaction with food, so you can take it at any time that you might want, either after eating or before eating, as long as you have no issue. Swallow amoxicillin capsules whole with a drink of water. Do not chew or break them. Like some people might like try to chew them or break them in the mouth, but it's better take it directly with water so that it goes direct. Amoxicillin is available as a liquid for children and people who find it difficult to swallow capsules. If you or your children are taking liquid amoxicillin, it will usually be made up for you by your pharmacist. The medicine will come with a plastic syringe or spoon to help you measure out the right dose. If you do not have one, ask your pharmacist for one. Do not use a kitchen teaspoon, or as it will not measure the right amount as you should take. Another question you should ask yourself, like if you forgot to take your tablet, maybe you were taking it 3 times a day and you feel like you skipped the one in the morning, or you skipped the one or at midday, or you skipped the one of night, like what can you do? If you forget to take a dose, take it as soon as you remember, unless it's nearly time for your next dose. In this case, just leave out the missed dose and take your next dose at the usual time. Never take 2 doses at the same time. Never take an extra dose to make up for a forgotten tablet. If you forget doses often, it may help to set an alarm to remind you. You should also ask your pharmacist for advice on other ways to remember your medicines. Like you feel you have that kind of forgetting, but actually don't do that. It's a medicine and you need to get well. If you take too much, what happens, or what can you do? Taking an extra dose of amoxicillin is unlikely harm to you or your children who might be taking this, but speak to your pharmacist or doctor if you are worried. You have taken more than prescribed dose of amoxicillin and have symptoms including like if you take it, you will be having these symptoms like stomach pain, or you're being sick, or blood in your pee, difficult peeing, or producing less pee than usual. So if you are taking amoxicillin and you see those signs, just go to the doctor and inform him about this, so they know in a way which they can help you. Side effects of this drug, amoxicillin, like all medicines, amoxicillin can cause side effects, although not everyone gets them, so it depends on person to person. Those common side effects happen in around 1 in 10 people. That is, like, the drug sounds to be more safe. Like if in 10 people 1 person gets those side effects, so the drug sounds to be safe. Keep taking the medicine, but talk to your doctor or pharmacist if these side effects bother you or do not go away. Feeling sick, like having nausea, diarrhea, and if you see this directly, go to your doctor if you are taking amoxicillin. There are other serious side effects which are not diarrhea or nausea, because many drugs you'll find them having those side effects, but the other serious ones. Serious side effects are rare and happen in less than 1 in 1,000 people. Diarrhea, possibly with stomach cramps that contains blood or mucus, or severe diarrhea that lasts for more than 4 days. Pale poo and dark pee, and the whites of your eyes or your skin turn yellow. Although this may be less obvious on brown or black skin, this can be signs of liver or gallbladder problems. bruising or changes in your skin color, joint or muscle pain that comes on after 2 days of taking medicine, a skin rash with circular red patches. This may be obvious on brown or black skin. Some of these serious side effects can happen up to 2 months or after 2 months, like after taking the amoxicillin prescription. The other serious allergic reactions, around 1 in 15 people have allergic reaction to amoxicillin. In most cases, the allergic reaction is mild and can take form of skin rash. Mild skin rashes can usually be treated by taking antihistamines. In rare cases, amoxicillin can cause a serious allergic reaction which is called anaphylaxis, and these are not all side effects of amoxicillin. For a full list, you can visit your medicine packet. You are given, when you are given tablets, there's an inside paper that you can read which will be containing more about this. Like, how do you cope with side effects of amoxicillin? Like, what do you do about it? Like, when you are feeling sick, stick to simple meals and do not eat rich or spicy food. It might help to take your amoxicillin after a meal or a snack. Like, when you are experiencing diarrhea, drink plenty of fluids such as water or swash to avoid dehydration. Signs of dehydration include peeing less than usual, having dark or strong smelling pee. Do not take any other medicine to treat diarrhea without speaking to a pharmacist or doctor. If you take contraception and you have severe diarrhea for more than 24 hours, your contraceptive pills may not protect you from pregnancy. Check the pill pack to find out what to do. Like, how about this drug during pregnancy and breastfeeding? Like, amoxicillin is very safe. It's very safe because you can take it during pregnancy and there is no anything bad associated with that. And amoxicillin, when taken during breastfeeding, it is okay to take amoxicillin while breastfeeding. Information shows that only tiny amounts of amoxicillin get into breast milk. Such as levels are not expected to cause side effects to your baby, so you can take it when you are pregnant, when you are breastfeeding. Amoxicillin is safe for that. Talk to your doctor or pharmacist or visitor or midwife if your baby is not feeding as well as usual. They have sickness or diarrhea, your baby has oral thrush or skin rash, you have any other concerns about your baby. So when you are taking this and you see those things on your baby, directly talk to your health consultant. And another one is about cautions with this medicine. Though we said it is safe, but there are some cautions that should be taken. There are some medicines that do not mix well with amoxicillin. Tell your doctor if you are taking any other medicines before you start amoxicillin. One of those include methotrexate, used to treat arthritis and psoriasis, and another one is warfarin, which is a medicine to prevent blood clots. Good medicines called probenecid or allopurinol and other antibiotics might not fit with this amoxicillin. Tell your doctor if you recently had or due to have or an oral typhoid vaccine. Amoxicillin can make it less effective. There is a little information about taking herbal medicines and supplements alongside amoxicillin. Thank you for being with us. Stay in touch. Please subscribe, like, and comment and share for other people to know about this. Ladies and gentlemen, welcome to the drug index. Today we are going to see para-acetaminophenol. Who knows that? Let's see and what you can say about this. That's far too complicated to say. So where you can call it acetaminophen, or if you are from US or Japan, or paracetamol if you are from British or from the rest part of the world. Paracetamol is much easier to say, and we are sticking with that today. Now, it's a really common Alzheimer's painkiller, and you might also know it by its common brand names like Tylenol, Calpol, or Panadol. Who knows it by those names? Why do we need it? Why do we need paracetamol? Why do we need para-acetaminophenol? But let's use paracetamol as we said we are sticking to it. Why do we need it? Well, it's a really awesome painkiller, and step one of painkiller. It's also good at treating fever because it reduces your body temperature just a little bit as well. It's so good, in fact, that's the most commonly used painkiller in the world, and is on the WHO list, WHO, for essential medicine. Now, I mentioned the painkiller. Who knows about that? That's a concept from the World Health Organization from about 1986, where they said these are the painkillers you start on, and then if they don't work, and then this, so on and so on. It's pretty good concept, and we still kinda of use it today. Not that I said add it, that's the key to good pain relief. So often painkillers are additive. You always look to start simple and then you add others in over time. You might ask yourself, really, how does paracetamol work? Well, we don't actually know for sure. That's the truth. We have a couple of guesses, but in order to explain how painkiller works, I probably need to explain a little bit about pain. So what's pain? What is pain? Well, you have all had it. It's an unpleasant sensory or emotional experience associated with actual or potential tissue damage. Now, the degree of your pain is not just the pressure, it's also things like personality and emotion can go into it as well. But awesome, pain keeps us alive. It stops you from dying. You figure it out with nociceptors. That's the fancy name of the receptors which are responding to things, and you have a ton of them, and loads of them work in lots of different ways. Some respond to pressure and hard pressure, soft pressure, so to heat, to cold, to spicy, and so on. When a receptor is activated, shoots off a signal to your spinal cord. When that happens, there is a reflex which tends to remove your hand or something else away from the pain, and it shoots off more signals to your brain, and your brain perceives the pain and turns the signal into an experience. Now, paracetamol probably works centrally in the brain and the spinal cord, activating pain-inhibiting pathways, blocking receptors, which trigger pain signals. But like I said, we are not entirely sure of how it works. After seeing why we need this and how it works, tell me in the comments what might you predict is the side effect of paracetamol. Well, it can cause nausea, and pain, but essentially it's a pretty safe drug, actually. That is when it's taken in the right dose. Overdosing paracetamol is extremely dangerous. It leads to acute liver failure. If you don't catch that early, sometimes even if you do it, lead to extremely unpleasant symptoms and even sometimes death. It's worthy pointing out that some people have had acute liver failure just from a little overdose. It's not like they have been like chugging the bottle or anything. They have just taken a few doses too many. Often maximum dose of an adult is about 500 grams a day. Don't go over that. And another word of warning, we see pretty commonly in hospitals that some drugs contain paracetamol, and you might not know it, but it leads to accidental overdoses. A really common drug is codamol. That's stronger painkiller because it contains an opioid called codeine, but the co in codamol is paracetamol, and some people don't know that. Did you know that? They take paracetamol as well, effectively doubling their dose. So don't make this mistake. But look, as always, if you are feeling bad or you are not feeling right when you are taking a drug, just talk to your doctor. Now on the Greek stuff, so goodbye. Most of you pray, but do not leave without subscribing and liking. Welcome to the Drug Index.